Serious, female doctors, nurse practitioners, and nurses of Reddit, what is the worst experience you have had with a male patient? As a nurse, so many things happened, but the episode that keeps haunting me happened in nursing school. I had to bathe a 40-ish-year-old who was perfectly capable of bathing himself. He suddenly popped out of bed and I attempted to get out of the way by moving toward the head of the bed. Wrong move. I was pinned in. He grabbed me, pushed me down on my knees and tried to thrust his swinging dong in my face while saying "suck it B." I was screaming for help. Some elderly physician arrived first and took the guy out with a kidney punch. I'll never forget either man. Is the good doc still alive? I was changing a disabled patient's disposable underwear and applying some cream to his groin, like the stuff you put on babies with nappy rash, when he motioned for me to pass his communication card so he could spell out his request. I had to watch in horror as he slowly spelled out WNKME, still holding his urine-soaked underwear in my gloves hands. I don't know if I should laugh, cry, or puke. Guy came into urgent care with pain in his dong. I took a look, saw something that looked like string in his urethral opening. So naively I thought maybe some thread of his clothes had gotten into his urethra and was causing irritation. So I went to get it out with some tweezers, and pulled about 6 centimeters of string out of there with little beads on it. While in residency, family medicine, older male patient came in complaining of trouble peeing, so I performed a prostate exam. Prostate felt normal so I gave him a lab form to test SAR and sent him on his way. No biggie. Then later that morning one of the female doctors in the practice came to me all, "Oh my god, you saw Mr. A today. I should have warned you. Was it trouble peeing or rectal bleeding this time?" Turned out that with every new female doctor in the practice, this guy made sure to get a rectal exam. For all other problems he always requested one of the male doctors. That's the kind of thing that should go in the patient chart. Had a patient in his 20s with sickle cell anemia and a drug problem. He ends up hospitalized with serious priapism, an erection he can't get rid of, and the thing is basically like a 2-liter bottle in his lap. I'm there assisting the doc with draining the blood every few hours as needed. Prior to round 3 of the draining procedure, he pulls me close to his bed and says, "Can you just try to ride it before that butthole drains it again? It'll never be this big again and it'd be sad to let it go to waste." I noped right out of that and had my male colleague take over for the rest of the shift. Had a male patient poke both my boobs and go beep boop while doing it and then wound up and smacked my butt when I turned around to leave the room. He thought it was hilarious. It was long-term care, so it's not like he was leaving anytime soon. I was on a community placement in a reasonably remote area visiting a patient with known mental health issues alongside a qualified nurse. Got to the house, had a nice chat with the gentleman about how he was getting on. He seemed well. We heard a knock at the door. The patient excused himself to answer it. A load of shouting followed and the nurse I was with went to investigate. Approximately 5 minutes passed and they both returned. The patient had chased the visitor down the road with a homemade meat cleaver and had highlighted the fact he had plenty of other weapons in the house. I was pretty glad to leave. Crap all over the bed and asked if I liked the smell, then proceeded to explain in explicit detail why he enjoyed it and would likely have another episode that night. He liked to sleep with it and it took the head nurse and multiple others along with myself to convince him to let us clean it up. You could smell it from everywhere in the air. Words cannot describe how vile. P.S. Thanks for all the upvotes, guys. Never thought so many people would like my story. Cheers. Just a CNA, but I had my arm broken by a patient because I turned off Miss America. I work in psych. He was psychotically obsessed with beauty pageants and I told him that if he didn't go take his meds, I was going to shut the program off. He ignored me, so I shut it off. TV was a very high privilege that he had not earned. He beat the ever-living crap out of me with a metal folding chair. You are not just a CNA, you are someone who cares for the broken, sick and hurting. You are a wonderful human being. Does Lady EMT count? Because I've had numerous drunk men propose marriage to me and a few guys masturbate while staring at me dead in the eye waiting for transport. Also one time a psych patient told me his brother's soul was hiding in my tea and he wanted me to take my pants off so he could say hi. I have to imagine that last part must have made you laugh at some point afterwards. I've got to admit, at the very least, It's an original pickup line. I was on midnight rotation. Someone came in the OR with a broken eggplant stuck in his rectal area and can't get it out. He said he accidentally sat on it during a prank. Maybe not the worst, but surely is an interesting one. This loosely answers the question, but thankfully I was not the woman in the story. When I worked in the hospital, there was this patient who was bedridden. He was very mean and smelly, and he'd pick at and eat his dead skin. None of the attendants wanted to do his personal care because of this. He had a wife that came in every day and endured his terrible comments and off-putting habits. I couldn't imagine what the source of their love was while he was there. He was my patient one day, and I had to start an IV on him in preparation for a procedure. I knocked on the door and heard nothing, so I cracked the door to check if he was okay. I found him in his recliner chair and his wife giving him BJ. A startling sight, especially combined with the pungent stench of him room. I'll never forget it. One night the cops brought this guy in from a holding cell at the station. He was complaining of respiratory distress, but it was really more of a panic attack. At first I felt bad for him. He was a young guy and he told me this was the first time he'd ever been in legal trouble. He said he'd gotten high and made a mistake. I remember hoping that whatever he'd done wasn't all that serious, as he seemed like a nice kid. Then I overheard the officers talking outside his room. It turns out he had confessed to violating and beating a woman who had been into our earlier that day for a SANE exam. I had briefly been her nurse as well, so I knew all the details of what had happened, and it was pretty horrifying. Having to be nice to him for the last hour of my shift was more draining than the 11 hours that came before it. My wife just had a 2x murderer in her station. He has cancer and is dying. She treated him like any other PT. My wife has been choked and hit and punched regularly. Point's husband snapped his fingers at me and told me to smile. I found that so much more repugnant than the confused older gentleman who reached into my scrub top and got a handful while I was straightening his blankets. At least Mr. Hansi had an excuse. He thought I was the H he ordered. A guy had a patient ask me why I was always smiling because he thought I would be prettier if I looked more serious. Like, yes my man, I'm here just to look pretty. Now tilt your head back so I can jam this swab up your nose. D. I'm a dentist, so hopefully that counts. While I was still in dental school, I had a 50-ish-year-old male patient who needed quite a bit of work. At our second appointment together, he bit me. Definitely intentionally in retrospect. I got bitten all the time. It's a hazard of the job, so I made my usual joke about needing to keep my fingers and kept working on his tooth. A minute later he started sucking on my fingers in an obviously suggestive way, so I quickly finished up the filling I was working on and let him go for the day before reporting him to the patient coordinator. I got him switched to a male student. God forbid we dismiss a patient for something like that when he has money to give us. A few weeks later I passed the patient and his new student in the hallway. By the time I saw him coming, it was too late to change direction. The patient made a beeline for me and sort of crossed his arms over his chest and pushed my body up against the wall, whispered "miss you," and walked away. I was graduating a few weeks later, so I didn't do anything about it, but he's probably some other poor little dental student's problem now. Contrary to popular belief, dentists are doctors too. If you needed affirmation of that, here you go, from some stranger on Reddit. I was about 20 and working as a nursing assistant at a hospital. Guy in his late 40s-50s came in for something relatively routine. Spilled his urinal in bed. I clean him up and he starts needing to pee like every 20 minutes after that. Starts saying things that are inappropriate like, "Does your father know what you do for work? You like working here? Your BF probably doesn't like this." This went on for hours, until I told my nurse, a middle-aged Mormon going through a divorce due to cheating. She went in. He not only didn't have any more accidents, he didn't ring the rest of the night. I've dealt with a ton of inappropriate things since then. I've been assaulted at work and had things thrown at me and rude comments, but none that made me feel sick the way that guy made me feel. The story in question didn't happen to me, but to my colleague. However, I was present for this occurrence. We're both nurses. We had this male patient who was a huge pervert. I have wide hips and a thin waist, and he would call me Nurse Hips and constantly try to grab my butt. He asked my colleague to assist him with putting his socks on or something similar, and he took his dong out and slapped her forehead with it. Needless to say, she had a shower and sanitizer. I wouldn't be able to keep my composure. I would punch him in his face, then sanitize a shower. I worked on a male ward in a private hospital, meaning nearly all had mental health issues. I was 18. I worked with the elderly, but on so much medication. The guys were strong. Had guys try to grab me between my legs, grab my butt and try to pull me into their beds. Fun times. I had a male patient on a ward pin me against a wall and he ripped my scrub top about halfway open. It was frightening. He was so much bigger than I am. It took 2 orderlies to get him off of me and he was screaming about how much he wanted to debauch me. ORN here. I had a patient on our psych ward one time who was having a psychotic episode, clearly very delusional. I'm a redhead and thus I have very white skin. This guy's room was directly across from my desk, and he stood in his doorway making statements about how pale girls got him hard. Once his behavior escalated, he stepped into the hallway in nothing but a sheet tied around his waist, and it was very apparent that he had not exaggerated his fetish for pale girls. He continued to make horrendous physical remarks about me for the next hour until the sedatives I'd given him kicked in. There's something just horrifying about being physically harassed in front of your colleagues and not being able to do anything about it. That was the longest hour of my life. I felt so humiliated by the end of it, in addition to the fact that I was actually afraid of this guy. He was much larger than I am. Most days I don't take work home with me, but I won't deny that I angry cried on my way home that night. Another male nurse here. Any hospital worth their salt should have some kind of policy and guidelines for staff protection against verbal and behavioral assault. Psych evaluation doesn't give patients free pass to do whatever she like at a cost of the staff well-being. I can't imagine feeling humiliated while working in the male or female staff member. I'm a nursing assistant. I've been asked to dance topless, to dinner, to rub their feet, to strip, to get into bed with them, to marry them. I've been offered money to leave my boyfriend and go with these old men who can't even walk. I've been asked by a patient to check for an inguinal hernia, not what he was there for, and to give the old Willie a good tug and asked if I fricked like a wildling. I look like a certain actress. I've been told that he has always wanted to try some white meat, that I will look good naked, and one patient was convinced I was his girlfriend and would throw fits if I didn't sit and eat dinner with him. This is all normal. I've been bitten, scratched, cursed at and spit on. I laugh at it now. You have too. Nothing beats the time I was helping a little old lady to her bedside toilet and as I lowered her down, she dropped her hands and full-handed grasped my butt cheeks and gave them a squeeze. There was no escape unless I dropped her. Then she tried to kiss me. She had 2 teeth. I set her on the toilet and pried her off me, then ran. Turns out the 90-year-old had wanted to experiment and thought I was gay. She was waiting hospice placement and figured her deathbed was the time to find out. I didn't go into her room again. Wowza. Do CNAs count? I had a patient try to grab my butt. I moved out of his reach and told him he couldn't do that. He demanded, indignantly, to know why not. I told him because it was inappropriate and not allowed. He angrily stated, but I want to, as if that completely justified it. I was 19 at the time. He was certainly old enough to know better. IDK that this was necessarily the worst. This kind of thing happened a lot, but this butthole was by far the most entitled. I'm paramedic, and have had multiple patients fake altered mental statuses in order to grope me or otherwise touch me inappropriately. Med student in the US. On one of my rotations I had several male patients consistently ask me if I had a partner, what my physical activity was them, and they were looking for details, whether or not I was looking to get married. To the patients themselves, coupled with the leering and incredibly inappropriate descriptors of my appearance, it got super draining. Luckily no physical harassment though. Yeah, I quickly learned to say that's not an appropriate question to ask me. Patient asked if I could come over to his house and shave him. Said it was okay because he lived with a bunch of Cantonese girls. I'm Asian. Really creepy dude. Really wanted to ask if the girls were kept in his basement but didn't want to end up there myself. A guy started obviously masturbating under his bedsheet when I went around on him as a med student. He did not have dementia or some other psychiatric illness, just a total creep. Kind of funny, but when I was a baby nurse working at an inpatient psych hospital there was a male patient openly masturbating in the lounge area. Of course I had no idea what to do, but my coworker grabbed a bottle of lotion, walked over and handed it to him, and said gruffly, "Go to your room." I got my turn later on working as an NP when I was called out to see an old alcoholic guy in the who was jerking it under a sheet while I was trying to interview him. It was the afternoon of the 11th of September, 2001, and I didn't feel like dealing with any more crap. I just said in a totally bitchy voice, "You need to stop what you're doing and listen to me." What a difference a few years of experience and maturity makes. Was sitting with a patient as a safety observer. He invited me to get into the bed with him, and when I refused, he started playing with himself and making loud, disgusting noises saying, "Do you want this? Do you want this?" over and over again. I stood up and walked to the door begging someone to come save me. "Can't leave the room when you're a sitter," and the secretary came in and yelled at him. He was in his 70s. Can't remember if he had dementia or not. I was a lot younger and was so shocked, I didn't even know what to say or do. For the rest of the shift he asked me if I was going to call the cops on him. Super creepy. Ugh. That he asked about the cops says he knew he was doing something wrong and just didn't give a frick. This was at an assisted living facility during a knock shift. I was one of the 3 total staff on for the night. This is while I was a CNA. Every patient had Alzheimer's dementia. This patient was known to act out physically. A lot of males with Alzheimer's do this. Another staff did come eventually, but it was to see why I hadn't finished the round. They brought him back to his room. Had a male patient try to strangle me when I was trying to let him out of the common area because he was urinating all over the floor. Had another patient, very large German man. He was a foot taller than me and outweighed me by 75 pounds. I was doing my rounds and I found him in another patient's room with his pants off and dong out. The patient was sleeping luckily. I said the German guy's name and he whipped around so hard I'm surprised he didn't fall. And then he started running up to me. I ran out of the room and ran to the dining room. It was the only room, other than a patient's room, that had doors that closed and locked. I locked the door and he caught up a few seconds later. This dude starts punching the door and trying to break through the glass. I thought for sure he was going to break the door down. Luckily he eventually stopped. Then he stared at me through the glass for almost an hour, waiting for me to come out. That's some Halloween 2 type of crap, but even more creepy. From my attending, apparently a very obvious opioid seeker came in, told her she was too stupid to be a doctor, and offered her a job as a stripper. She said no. He said she was too ugly to be a stripper anyway and he was going to kill her. She told him she put a flag on him so nobody would give him opioids in state. He did not kill her, but he did come in several more times and offered every female nurse and female doctor he saw a job as a stripper. Dentist here. I was extracting a tooth when the male patient started laughing. I stopped to see if he was okay, thinking it was nervous laughter. He said, "Your boobs are big and they're in my face." I found the polite thing to do when you have a well-endowed dentist that doesn't realize she's resting her breasts on your head while she's working on your teeth is to pretend that isn't happening and not pee off or distract this nice doctor with metal instruments and power tools in your mouth. Most of my time in a hospital the men could be a little creepy or the confused ones would do gross things, but the worst was a 20-something type 1 diabetic guy. He had no mental illness or deficit. He was in the hospital for uncontrolled blood sugar and was throwing a fit because he wanted a hamburger and fries for lunch. I told him that the hospital does not serve that, but if he wanted family friends to bring food in for him that was allowed. When lunchtime came, I carried his tray into his room and set it on his table. He took the cover off, and much to his dismay it was a chicken sandwich and vegetables. He asked, "What is this?" and as I turned to respond he chucked the chicken sandwich at my face. I no longer work in a hospital. Hope PSW is alright. I work in assisted living and we had this couple. The wife had Parkinson's and needed help transferring. You had to be careful not to bend over while helping her move, because if you did her husband would remark, "Ooh, I just want to smack that bum from over in his armchair," while making the hand motions. His wife was right there. It boggles my mind to this day how she managed to put up with him doing that. Reprimanding him didn't help. He just didn't understand that he shouldn't harass women. Nurse here. When I worked in a nursing home, we had an old man with mild dementia who was well known for getting handsy with any female he came across. One day my boss told me to take him away from the front door so he wouldn't bother visitors. He was sitting there napping quietly in the sun, bothering nobody. When I woke him up and told him to come with me, he clearly thought I was coming onto him. He started following me around and trying to corner me, touch me, etc. I made a poor decision to sit in a chair, in an attempt to get him to sit in the chair next to me, with my face now at groin height. He took his chance, grabbed my head and smashed my face into his old mandicant balls. When I told my boss about it, she said it wasn't assault because he had dementia and refused to report it. Told me I needed to be more resilient and just get over it. These things happen when you're a nurse. I'm willing to let go of a lot with our dementia patients, but that is still physical assault. Your boss is not a good person. I hope you got whatever help you feel you needed after that incident. A 90-plus-year-old, demented man grabbed me by the shirt and started punching me over and over again in my ribs, like really hard. I was screaming for help and finally 2 other nurses pulled him off of me. I had huge bruises where he punched me and it hurt to move for a while. I was just trying to disconnect his IV antibiotics. When I was in nursing school I worked as a nurse's aide in an assisted living facility. I went into a patient's room to change his bedsheets while he sat in his recliner watching. He asked me how old I was and I told him I was like 20, and he asked if I was married yet and I said no. Then he asked if I've ever known the loving of a man. I just kind of looked at him weird and ignored it. Then he kept saying, "You could if you wanted to, you know. I could show you." Then I looked and he had his flaccid old man dong hanging out of his pajama pants. He winked at me, licked his lips and said sit on it. I ran out of there pretty fast and got the old lady LPN to go deal with him. In hindsight, I wish I would have laughed at him and said sit on what. Thankfully I work in L&D now and just deal with women and their babies. Much more pleasant. Nibarn here. Had a patient who would constantly push the call light. When you go in to answer it he would have his hospital gown pulled up and his junk out. Then he would make lewd comments. He would sit on the edge of the bed with himself exposed so everyone in the unit could see his junk. When we tried to close the curtain he would yell, "Nurse, open the curtain." We told him he needed to stop exposing himself. He would respond that he was hot or the gown was uncomfortable and that he didn't care if anyone sees him, as if he was not actively trying to flash himself in a physical manner. We quickly got tired of his crap and would pee every time he hit his call light. Then he started complaining that the nurses were B and nobody would smile when speaking to him. In our facility you have to go into the room to cancel the light. We started just going in and hitting the light without making eye contact or speaking to him. We quickly only assigned male nurses to care for him. Each time he was assigned a male nurse he would demand a different nurse but would not state the reason. The charge wouldn't stand for it and would not change his assignment. Anytime a female nurse would pass his room he would demand that she come in and help him. As he was being wheeled out for discharge he saw me having a conversation with someone and I laughed and smiled at a comment. The patient interrupted us and said in a very passive-aggressive manner, "So you can smile. I love to see a pretty girl smile." I looked at him deadpan and said, "I'm smiling because he is leaving." He gave me a dirty look. I'm a female and in med school, slightly petrified reading these. Pray for me. Yet female stage 1 nursing student and a lot more worried about my second placement in a fortnight's time. A little off topic, but my wife and I used to deliver meals to the elderly and disabled. We had a regular route and got to know our clients a bit. One time my wife went into the house of one gentleman we'd gotten to know. She knocked. He said, "Come in." And there he was, an 80-plus-year-old man, feverishly masturbating naked. My wife's not a prude, but was really shocked. She just dropped off his food and left. I did his deliveries after that. Had a 6'8", 350 pounds guy detoxing from alcohol and who knows what else try to beat the crap out of me. He took a swing at me and leapt out of bed to come after me, but of course he stumbled everywhere. I'm 5'3", 110 pounds. He was quick, but I'm quicker. Ran out of the room and screamed for security. All of a sudden with 6 men in uniform surrounding him he can behave himself. Dude, nurse here. During one of my clinical rotations in school, I had a patient who grabbed my crotch, then proceeded to tell me he wanted to stick his finger in my butt and lick it clean like a fudgesicle. A couple of the nurses on the unit decided to call me fudge for the rest of the semester. The guy wasn't my patient. It was his wife who gave birth to their baby. Didn't stop him from deliberately feeling my breasts when I handed him the baby when she was in the bathroom and called out for help. What a champion. This one makes me sad. Doctor here. Hey, I was leaning over the bed to listen to an old male patient's chest and he suddenly grabbed me and pulled me onto the bed with him, groping my bum and trying to kiss me. He wasn't delirious or obtunded. He had planned it out with his older brother as a joke. It didn't go over well. B. I have had far too many happy ending comments to my penile scrotal exams. I am Asian. To the point that I have a memorized response ready to go. I can cut it off. It would be a happy ending for me. C. I have had patients fake illnesses to get examined by me, and at the end of the exam ask me out. I can cut it off. It would be a happy ending for me. Bless you. Well, I've worked in long-term care facilities before I graduated college. The dementia unit was horrifying, and I've worked on a couple different ones. My biggest problem was constantly having residents accidentally get caught masturbating. We're actually taught to just politely say excuse me and close the door, but they usually say no, you can stay or something of the kind. Of course, I don't. I also got a lot of boob pinches, butt slaps, crew name calling, etc. It was actually the little old ladies who were the most physically violent with punches, slaps, and scratches. But my worst ever? Strap-in. Very large 45-year-old male, at least 400 pounds, in a long-term care facility because he was dying. I was new to the floor, and I walked in to introduce myself to him and make sure he was dry. I had worked with plenty of bariatrics before, but I smelled it. There were literal puddles. Puddles of pure liquid diarrhea in the massive bed he was in. It was soaked into the linens. Oh my god. I'll never forget it. It splashed on me. I tried my best to be nice, but he laughed at us and kept farting and, oh my god, I'm having flashbacks. We ended up throwing the linens away instead of trying to rinse them. That was years ago and I still remember his name. I'm a phlebotomist. We had somebody come in from one of the nearby prisons. He had sepsis and we needed to do blood cultures. He was handcuffed to the bed and there were two COs with him. I went in, introduced myself, got my supplies around, and once my needle was in his arm he started telling me the horrifying details about what he did. How he kidnapped a little girl, debauched her, awful things. I just said oh yeah, well that's interesting, and basically being polite but not giving him the rise he's looking for. He's not the first to try to do that. We have psych patients who try to freak us out. Only difference is this guy wasn't lying. Couldn't you wiggle the needle by accident? On behalf of my wife, showering a patient on one of her first weeks as a nurse and the guy says, I bet that's the littlest peep you have ever seen. Most light-hearted answer so far. My sister is a labor and delivery nurse and says a surprising amount of male L&D staff and fathers think the mothers are wimps for admitting they're in pain and think all the blood poop waters are disgusting. I have heard some very aggravating stories about male L&D staff, including one male nurse who would comment to the other staff about the appearance of patients' twats. As a pregnant lady, it's rather upsetting to think about. Yanked the call light out of the wall, swung it around his head like a lasso, and yelled at us all as we tried to calm him down. Get her, lil piggies. He'd been making fat jokes at every woman who came in. Ducking a call light remote whipping through the air ain't no joke. He did this twice more during my shift. Our bells make a very loud, insistent, rapid dinging when they are pulled out of the wall, which just adds to the fun of that particular rodeo. It was the first and only time I ever saw a supervisor okay someone to not have a call bell. I doubt legal appreciated that, but the rest of us sure as frick did. This one was great. I've seen them used as corn cobs and nooses, and chewed on, but never a lasso. Sometimes it's co-workers. You look so alluring in your white uniform. I was a student, all of 19. He had to be 50 and I would swear wore his scrubs commando. Or the one I'd worked with forever who tried to snog me when I confided in him how depressed I was. He was well aware that I was married. This is the goodest flyboy. He will bring you 10 years of happiness in exchange for a like on this video. Like and subscribe, you magnificent person.